It often starts with something so small, so ordinary, that we don't give it a second thought: a little itch on your leg, your back, or your chest. You scratch, you move on. But what if that itch wasn't ordinary? What if, hidden beneath the surface, your body was trying to warn you, softly, quietly, long before pain or fatigue ever showed up? Doctors have begun to recognize a startling truth: in some cases, unexplained itching, especially when it's persistent and focused in certain areas, can be one of the very first signs of cancer. For people over 60, these itches can appear months before any other symptom. No visible rash. No fever. Just a strange, restless sensation that refuses to go away. In this video, we're going to explore 5 specific locations on the body where recurring itching has been linked to serious internal illnesses. These aren't vague theories, they're based on real patient patterns, clinical observations, and years of silent warnings that often came too late. You don't need to panic. But you do need to pay attention. Because cancer rarely arrives with a shout. It begins with a whisper. And sometimes, that whisper feels exactly like an itch you can't explain. Sign 5. Persistent itching in the anal or genital area. There are few things more uncomfortable, and more often ignored, than itching in the anal or genital region. It's an awkward subject, especially for older adults, and many people would rather brush it off than bring it up. But when this type of itching becomes chronic, with no obvious cause like hygiene, infection, or irritation, it may be trying to draw your attention to something far more serious. In some cases, persistent itch in this area can be a quiet early symptom of anal, vulvar, or even penile cancer. What makes this kind of itch dangerous is that it often disguises itself as something minor. People assume it's just dry skin, a reaction to toilet paper, a bit of friction from walking, or even a side effect of incontinence pads. And in many cases, it is. But when it lingers for weeks or months, when it returns no matter how much you clean, treat, or moisturize, and when it begins to feel more raw or burning than surface level, it deserves a closer look. There was a man named Harry, 76, who had been dealing with what he thought was hemorrhoid irritation for almost a year. He used creams, changed his diet, even tried cold compresses, but the itching never fully went away. Eventually, a colorectal specialist ran a scope exam and found a small lesion on the anal canal wall. It turned out to be an early-stage tumor, something that would have continued growing silently had he not followed his gut instinct that something just didn't feel right. The same holds true for women. Vulvar cancer is relatively rare, but becomes more common after age 60. And one of its earliest signs, a recurring itch on or near the outer genital area. There may not be a lump, but the skin might begin to feel rougher, slightly discolored, or thinner than usual. Many older women assume it's hormonal or related to postmenopausal dryness, and sometimes it is. But if the itching is relentless, if it worsens at night, and if it doesn't respond to normal treatments, don't dismiss it. This part of the body is full of nerve endings. It's highly sensitive, and because of that, it often signals internal changes before more visible symptoms emerge. Whether it's a change in skin cells, nerve inflammation, or swelling in nearby lymph nodes, chronic itching in this region, especially when it's only on one side or focused in one small spot, can be a red flag. And yet, most people hesitate to say anything. They fear embarrassment. Or they worry they're overreacting. But silence is far more dangerous than curiosity. Speaking up about an itch might just lead to early detection, better outcomes, and peace of mind. The most important takeaway: if the itch doesn't go away, don't assume it's normal. Let a healthcare provider take a look. Because catching something early, even something as serious as cancer, often starts with noticing something small, something subtle, and choosing not to ignore it. Sign 4. Localized itching on the chest or breast area. There's a spot on the body many people overlook when it comes to signs of something serious: the chest. For women, and yes, even men, an itch near the nipple, just beneath the breast, or across the chest area can feel harmless. Maybe it's the weather, your laundry detergent, or a tight shirt. But what if it's not? Persistent, focused itching in this region, especially when there's no visible rash, no skin condition, and no relief from lotion, has been connected to one of the most aggressive forms of breast cancer, inflammatory breast cancer. The challenge? It rarely begins with a lump. Instead, it starts as warmth, tightness, or a strange roughness in the skin. But often, there's nothing to see, just an itch that refuses to go away. Ruth was 69 when she first noticed the sensation. She changed bras, switched detergents, even went braless for a few days. But the itching came back every day, same spot, same stubborn discomfort. When she finally mentioned it to her doctor, they noticed a barely visible skin dimple and sent her for imaging. What they found was a small but fast-moving tumor nestled near the surface of the breast, something that didn't feel like a lump, but had been quietly growing all along. That's the danger. Inflammatory breast cancer doesn't play by the rules. It can spread before any lump forms, and its first symptom is often mistaken for nothing more than irritation. That's why a lingering itch, especially one that doesn't migrate or respond to creams, needs to be taken seriously. Men, too, should take notice. Male breast cancer is rare but not impossible. An itchy patch around the nipple, a thickening under the skin, or a tugging sensation across the chest might not raise alarm bells, but it should, particularly if you're in your 60s or beyond. And it's not always the breast tissue itself. Enlarged lymph nodes in the armpit or collarbone area can press on surrounding nerves and cause localized itchiness long before swelling becomes visible. It's your body nudging you to pay closer attention. So if you've noticed a nagging, focused itch on your chest, especially if it's paired with any feeling of heat, swelling, or subtle tightness, don't dismiss it. Awareness, not anxiety, is the goal. Because early detection doesn't start in a hospital. It starts with you. It starts with noticing what's changed, however small, and having the courage to speak up. And if this message resonates with you, drop a number 4 in the comments to let me know you're here and paying attention. And don't forget to subscribe and tap the bell, so you never miss a message that could make all the difference. Sign 3. Itchy scalp without visible flakes or dandruff. At first glance, an itchy scalp might seem like nothing, a minor nuisance caused by dry air, shampoo residue, or simply getting older. But for many older adults, a stubborn, unexplained itch on the scalp can be the first sign that something deeper, more serious, is happening beneath the surface. Unlike typical dry skin, this kind of itch often feels strange. It's not just dryness, it's tingling, burning, or a crawling sensation that seems to come from beneath the skin, not on it. This type of discomfort doesn't go away with over-the-counter remedies. Moisturizing oils, anti-dandruff shampoos, even prescription creams often have little to no effect. That's because in some cases, this itch isn't a skin issue at all, it's a neurological response triggered by abnormal immune activity in the body. In blood-related cancers like leukemia, the uncontrolled growth of white blood cells disrupts the immune system, leading to inflammation that can irritate nerves, especially in sensitive areas like the scalp. One example that stands out is from Patricia, 71, who started noticing a strange itching sensation at the crown of her head every evening. she assumed it was a reaction to her new shampoo. Then she blamed her pillowcase. After weeks of no improvement, she visited a dermatologist, who saw nothing unusual. But when Patricia mentioned she had also been feeling unusually tired and bruising easily, her doctor ordered a full blood panel. The results showed abnormally elevated white blood cell levels. After further testing, she was diagnosed with early-stage leukemia. Stories like Patricia's are more common than most people realize. Many older adults accept odd symptoms like this as part of aging. But cancer-related itching is unique in its persistence and resistance to treatment. It doesn't respond to creams. It doesn't move around. And often, it feels disconnected from any visible issue on the skin. Additionally, certain types of skin cancer, particularly in people with thinning hair, can start on the scalp and present as nothing more than an itchy patch. If left unchecked, what starts as a mild irritation can become something much more dangerous. That's why it's crucial to regularly examine the scalp, or better yet, ask someone you trust to help spot anything unusual. If you've been dealing with an itch that lingers for weeks, doesn't improve with typical care, and seems to intensify at certain times of day, don't brush it off. Especially if it comes with other signs like fatigue, night sweats, or unusual bruising. Because sometimes, what feels like the smallest symptom can be your body's very first cry for help. Sign 2. Itching between the shoulder blades or upper back. There's a specific kind of itch that shows up deep in the upper back, right between the shoulder blades, that's often ignored or blamed on posture, dry air, or even an old shirt tag. But for many older adults, persistent itching in this exact area, especially when it feels like it's coming from under the skin, has been linked to pancreatic cancer. And the strange thing is, it often appears months before any noticeable pain or digestive symptoms do. The connection might seem odd at first. How could an internal organ like the pancreas cause itchiness way up on the back? But here's how it works. When pancreatic tumors begin to grow, they can obstruct the bile ducts, those small tubes that help drain bile from the liver into the intestines. When this drainage slows or stops, bile salts start to accumulate in the bloodstream. And one of the first things those excess bile salts do is irritate nerve endings, often in areas like the back where the body stores a dense network of sensory nerves. I remember a woman named Lucy, 70, who told me she had what she called a phantom itch on her upper back. She'd wake up scratching it every night. Nothing helped. Lotions, back scratchers, even changing her mattress. She said it felt like it was coming from the inside. When she went in for blood work for unrelated fatigue, her liver enzymes came back elevated. That led to imaging scans, and eventually they found a small tumor in her pancreas pressing on the bile duct. The scary part? That itch was her only real symptom. No pain, no yellowing skin, just a deep, nagging sensation she couldn't shake. And the only reason she caught it early was because she spoke up, even when it felt like a small complaint. This is why that specific area matters. General back itchiness can come from dryness, pressure, or friction. But if the itch is focused, unrelenting, and doesn't improve with skin treatments, especially if you also notice darker urine, pale stools, or fatigue, it may be a deeper sign of something happening internally. The back becomes the messenger, even when the problem is in the gut. For older adults, these kinds of subtle symptoms are easy to dismiss. We don't always want to sound dramatic, but your body is wiser than you think. And when it sends you the same signal again and again, it's worth listening to, even if it's just an itch. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Sign 1. Persistent itching on the lower legs. When older adults start to experience a persistent itch on the lower legs, especially the shins and calves, with no rash, no dryness, and no new soap or lotion to blame, it might be easy to write it off as aging skin. But this very specific symptom has quietly shown up in many people diagnosed with blood-related cancers, especially lymphoma. It's not the kind of itch that comes and goes. It lingers. It often gets worse at night and it doesn't respond to lotion the way dry skin does. The reason this happens has to do with how cancers like Hodgkin's lymphoma affect the immune system. These cancers originate in the lymphatic system, a critical part of the body's defense and drainage network. As the cancer cells multiply, they release inflammatory chemicals into the bloodstream. And one of the most common side effects of these chemicals is a deep, almost burning itch that settles in the lower limbs. Even though the skin might look completely normal on the outside, the nerves underneath are being irritated from within. There's a man named Roman, 75, who shared his story during a routine cancer awareness event. He said his only symptom for nearly 6 months was an uncontrollable itch on the front of his legs. His doctor initially thought it was eczema or maybe a reaction to detergent. But when blood tests showed abnormal white cell levels and further scans revealed swollen lymph nodes in his chest, the diagnosis became clear. The itch came first, he said, long before anything else. This kind of story isn't rare. And while not every itchy leg means cancer, the key difference lies in how the skin responds, or doesn't. If there's no rash, no new soap, no bug bites, and it's been going on for weeks, it's time to dig deeper, especially if it's paired with other quiet signs like night sweats, fatigue, or unexplained weight loss. For older adults, this kind of awareness becomes especially important. As we age, our bodies become less obvious in how they send distress signals. The pain might not come right away. The lumps may be too deep to feel, but the nerves still react. An itch, particularly deep, restless, unrelenting itch, is often how that reaction first shows up. If you or someone you care about has been scratching their legs every night, applying creams with no relief, and wondering why nothing's working, don't ignore it. Talk to a doctor, ask about blood work, mention the pattern. Because sometimes the body whispers long before it shouts, and listening can make all the difference. Your body has its own language. It rarely shouts. It whispers, through tiny signals, quiet changes, subtle discomforts that are easy to overlook. A patch of skin that won't stop itching. A strange tingling you can't explain. These aren't just random annoyances. Sometimes, they're the first clues that something more serious may be stirring beneath the surface. But here's the empowering truth: when you pay attention, you give yourself a chance. A chance to catch problems early. A chance to ask the right questions. A chance to take control of your health before something small becomes something serious. That kind of awareness isn't fear, it's wisdom. It's the kind of wisdom that grows with age, and it can save lives. So, if today's video helped you see your body a little differently, or reminded you of someone who might be ignoring their own warning signs, take a moment to share this message. And if you haven't already, please hit that subscribe button and turn on the notification bell. We're here to bring you valuable, science-backed content that could make all the difference, one quiet signal at a time. Thank you for watching, and remember, your health always starts with listening.